Here's your reminder that all medical devices are only made with skinny, able-bodied men in mind. I have been having really intense dysautonomia, POTS symptoms, and I went to the cardiologist. I also was born with a congenital heart disease, and I'm supposed to go every year, but I haven't gone for like 4 years because I've been avoiding getting a stress test, which I'm also going to have done now. But the main thing I'm here to talk about is this heart monitor that they are having me wear for a week. I've worn it for 2 days as of now. And as you can see here, the way that these are set up are in a way that the electrode wrinkles right where my chest is. And especially when I'm sleeping, wearing a bra makes it even worse, but I refuse not to wear one. It wrinkles so much that this is only the second day I've had it on, and when I went to go shower, it basically tried to throw itself off of my chest. Fortunately, I had some of these Tegaderm patches that I had to put on top of it, but as you can also see, I have an allergy to adhesive. And I have had these red rashes under this patch, but now under where the Tegaderm is. And I told them that when I wanted to, or when they were asking me if I wanted to get this done, and I was like, well, it probably is going to help if I have this heart monitoring test done, but I'm allergic to almost all medical grade adhesives. And they told me that the Zyopatch ones is for sensitive skin. I looked it up. That's not even true. It's actually one of the worst ones if you have sensitive skin. The prep that they do is they shave the area, like they dermaplane it, which I cannot dermaplane my skin, my face. If I ever dermaplane my skin, I end up getting really bad rash and breakouts. So I was already really hesitant about that. And then after that, they use this like exfoliation scrub that's basically like sandpaper. And that's where I said, no, I'm not doing that. And yes, that's probably why it's not sticking to me as well, but I have a connective tissue disorder. And having a connective tissue disorder means that my skin is stretchier, which also makes this wrinkle more, but it also means that it's softer and much more fragile. If I scratch at my skin too hard, I can just scratch the skin off. I can't pop pimples, like do anything. If I squeeze the skin too hard, literally chunks of skin just come off of my body. And so when they said they wanted to do the exfoliation, I said no, because what was likely going to happen whenever I've used any sort of exfoliation, which is why I'm no longer allowed to use manual or chemical exfoliation, the skin rubs off and I get these micro fissures and micro abrasions. And then I was going to be putting this adhesive on top of it, which is just asking for an infection or an allergic reaction to happen. And it's just so frustrating. Like, it's 2024, the smartwatches are a thing. I know that the technology in them isn't perfect with heart rate monitoring, but when I was at the doctor's office, we actually pulled up the health app on my phone because I have an Apple Watch, and she looked at my data there, and looking at that data is what made her decide she wanted to do a heart monitor situation. And part of why like these are used is because I get to click on this button if I have like an event, if I have any symptoms, and then I log it through an app. So like it collects the data in a way that's easier for doctors to interpret, to determine diagnosis, or like what the results actually mean, more so than if I just gave them my Apple Watch data. However, if I were to like there should be an app that exists for smartwatches that lets me do this, where I can still log things and give them data, because this is just not it. Like, this is not going to work for anybody who has any additional meat on their bones, has boobs. Like, it's not effective. And if it falls off, I'm supposed to call them and they will send me another one. But if it falls off also because I'm having rashes like I am, it doesn't really matter. Like, I'm not going to want to put another one on. And it's especially important that these stickers stay down because that's where the electrodes are that are actually like measuring my heart rate. I don't know, I just feel like we should have a better system for this. And if this is being tested on AFAB bodies or people that have breasts or people that have fat on their chest, I think that we would have a better system by now. But no, it's not. It's only being tested predominantly on men.